predicting the necessity of adding catheters to intracavitary brachytherapy for women undergoing definitive chemoradiation for locally advanced cervical cancer. Via brachytherapy. Publication date, available online August 9, 2018. Source, Brachytherapy. Authors, Daniel Moore Freitas Palhares, Daniel Grossi Marconi, Tatiana Leitão de Azevedo, Clayton Burnett Hess, José Humberto Tavares Guerreiro Fregnani, Renato José Affonso, Ana Carolina Lima Chaves Veneziani, Heloisa Pilisar Canton, Rodrigo Gadia, Marcello Dimas Spadium, Rodrigo Ribeiro Rossini, Mitchell Camrava. Abstract. Purpose. To identify if baseline patient or magnetic resonance imaging, MRI, features can predict which women are at risk for inadequate tumor coverage with only intracavitary tandem and ovoid, D+O, brachytherapy and to correlate tumor coverage with clinical outcomes. Methods and materials. We performed a retrospective study of 50 women with cervical cancer treated with chemoradiation at a single institution between January 2014 and December 2015. All patients had a 3T MRI performed at baseline, MRI 1, and at the completion of external beam radiation therapy, MRI 2. Gross tumor volume initial, GTV TINET, was measured on MRI 1 and high-risk clinical tissue volume, CTVHR, on MRI 2. CTVHR extending beyond point A was classified as too large for adequate coverage with T+O and requiring interstitial needles. Multivariate analysis was performed to determine predictive factors of inadequate coverage. Kaplan-Meier and Cox regression were performed to correlate inadequate coverage with outcomes. Results. Mean patient age was 49.2 plus/minus 13.2 years, and 84% had Federation of Gynecology and Obstetrics IIB/IAB disease. 42% of women were estimated to have inadequate tumor coverage with T+O brachytherapy. The GTV TINET volume and dimensions, superior-inferior, left-right, anterior-posterior, on MRI 1 were all important predictive factors of inadequate coverage on multivariate analysis. Receiver operating characteristics curves identified optimal thresholds of superior-inferior greater than or equal to 4.5 cm, area under the curve, AUC, equals 0.718, left-right greater than or equal to 4.5 cm, AUC equals 0.745, anterior-posterior greater than or equal to 5.0 cm, AUC equals 0.767, and GTV TINET greater than or equal to 85 cubic centimeters, AUC equals 0.842. Patients with inadequate coverage had worse clinical outcomes. Conclusions. Baseline MRI tumor size may predict inadequate CTVHR coverage at the time of brachytherapy, that is, the need for interstitial needles. This may help identify a subset of women requiring early referral to adequately resourced centers to improve clinical outcomes. Add tags, currently, therapeutics, #medicine by Alexandros Sfakianakis, #ola by Sfakianakis G. Alexandros.